Watching out for you tonight, and right now a lot of us uncertain about what to do, what to buy, how to cope. Grocery stores selling out of food and toilet paper. Well, alcohol is also selling fast. Many stocking up on beer, liquor, wine during this pandemic. And while it's been a boom for some local businesses, it's also a health concern for some. News 5's CAITI BLASE speaking with local experts on some good reminders for all of us.
Well, with most of us not going into the workplace right now or being able to see family and friends, it's a stressful time, and people are turning to a variety of coping strategies, one of them being alcohol.
It was like Christmas in March.
Gregor, owner of Downtown Fine Spirits and Wine, says it was around St. Patty's Day when hordes of people started coming through his business.
People bought humongous amount of bigger quantities, i.e. box wines, cases, etc. So it was crazy.
Fearful of the restrictions setting in due to the coronavirus, people stocked up on alcohol.
We had lines going out the door.
According to a Nielsen study, alcohol sales were up 55% the week of March 21st. Compared with March 2019, it's a pretty big spike. The Colorado Licensed Beverage Association agrees. The organization says there are approximately 1,600 liquor stores in the state, and that many are reporting anywhere from a 12 to 18% increase in volume of sales. While HUESGEN says things have slowed down a bit since that initial rush, business is still elevated. And with so much alcohol now on hand for people in their homes,
we're certainly worried about that.
Because for some, alcohol is a coping strategy.
In times of stress like this, it's really easy to fall back on bad habits and overindulge in certain things that can really cause more problems in the end.
Things like alcohol, other drugs, access is a key thing. If I have it right there, I am more likely to reach to it and use it.
While both men say there's nothing wrong with having a drink every now and then, moderation is key.
It's even more important now than it is on any other time. Make good decisions about what you're putting in your body, how you're handling the stress that you're under.
And stress is something we're all feeling right now, some more than others. Bell tells me through his own sessions and speaking with fellow counselors,
the use has definitely gone up.
He's seeing a mix of behaviors with his substance abuse clients.
Some of them are continuing along doing fine. Others have definitely relapsed back to heavier use. And they're struggling with that. The anxiety is a big part of it, and actually just the whole social isolation piece of it.
While he isn't seeing an uptick in clients right now,
my guess is once things start heading back towards normal, it's going to change. People who have gotten into perhaps drinking heavier during this period, now they're having to get back into the real world.
Ray Carrington is a clinical mental health counselor for A Good Life Counseling. He primarily works with court-ordered substance abuse cases, people who've gotten DUIs or committed other crimes related to alcohol.
We're seeing more relapse than we have in the past.
He says a big issue is the change in external support for clients.
You have people that are really involved in the gym, they're really involved in the incline, and these are things that they are supplementing in their life to maintain their sobriety, and it all closed one day. The longer this goes, the harder it's going to be, and I'm not sure we can push back hard enough with resources.
But he says everyone in the mental health field is doing their best, trying to get more telecare events going on and increasing availability to those who need help. So if you are someone struggling with alcoholism or feel like you might be headed down that road,
rather than reach for a bottle to pour myself a drink, can I do some breathing? Can I maybe go for a walk, do something along those lines to help calm myself down? Exercise in general helps a lot. Of course, eating a healthy diet helps a lot. The connection through video, phone, whatever.
But of course, if things escalate,
there are lots of counselors available to talk to. Some are doing it in person, some are doing it through telehealth.
So remember this, while resources and life in general aren't normal right now, there is help and hope out there. And in this time of uncertainty, it's important to deal with a substance abuse problem sooner rather than later.
That's as critical as it is as wearing the mask and staying away from the virus. Is if we're not taking care of ourselves in other ways, then that can be just as dangerous, if not more.
And if you or someone you know is struggling with substance abuse, counselors recommend reaching out to SAMHSA, the Substance Abuse and Mental Health Services Administration. They have a crisis line and counselors you can talk to 24/7 who can help you get connected to resources. That number is 1-800-662-4357. Always watching out for you, Southern Colorado. CAITI BLASE, News 5.